Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Good morning and welcome to the Cardinal Minute. I'm Dr. Kim Allen Williams, chair of the medicine department here at the University of Louisville. And it's my pleasure to introduce for the Cardinal Minute our professor of medicine and director of our inflammatory bowel disease program. And that is Dr. Gerald Dryden, also known as TAD. And he gave a wonderful grand rounds this morning talking about inflammatory bowel disease in 2022-23, not just bugs and drugs. And Dr. Dryden, can you give us a 1-minute summary of your talk?
Sure. So there have been a lot of advances in the realm of inflammatory bowel disease that are outside of the big pharmaceutical products that are being regularly touted to our patients and administered to our patients, and really giving us great results. We're now beginning to understand more about the pathophysiology and the role of bacteria in the development of inflammatory bowel disease, both Crohn's and ulcerative colitis. Also, the role of these bugs in the chronicity of inflammatory bowel disease, and how can they can actually develop or influence the development of complications of inflammatory bowel disease. We've been able to now differentiate between low risk and high risk inflammatory bowel disease patients, which may enable us to be able to more appropriately put that very effective pharmaceutical therapy or pharmacologic therapy toward those patients that need it the most. And maybe the patients that perhaps don't need quite as much intervention may be able to benefit from dietary therapy, which is now being evaluated in both Crohn's and ulcerative colitis. So from the pediatric literature, there are some very convincing studies that there is a role for nutritional therapy or diet therapy in managing chronic inflammatory bowel disease. So pediatric populations have been able to be shown or have shown to have a benefit from intervention, both enteral nutrition with various formulas, as well as a change in the diet, particularly leaving out meats or highly processed foods, really getting to a vegetarian type diet or a non-refined diet that can show significant impact on disease outcomes. We're going to be able to utilize new technology that's not been used in the United States, but has been widely used in the rest of the world to be able to evaluate our patients, including intestinal ultrasound, which correlates very well with colonoscopy as well as MRE, allowing us to be able to have almost a point of care evaluation or assessment of disease activity or resolution in response to therapy. Oh, you're muted. Muted.
Yep. So thank you very much. And we really appreciate your expertise and look forward to seeing more developments in this area.
Awesome. Thank you so much.
Thanks.